Okay, we're back at Divine Equestrian with Carrie's ride in Galante. Now, Galante is an 11-year-old British bred pre. Now, pre's are, of course, the Spanish purebreds. And, well, it's beautiful horses. The pre's are absolutely wonderful horses. But not thought to be suited for dressage, and yet Galante is really good at dressage and enjoys it. And you can see, although it's a really cold day here today, we're slowly riding him at walk to warm his muscles up, and we make sure we do this really slowly before getting into any quicker work. So with Galante, we're showing this one as an example of a good mover. So you can see the front legs really striding out when he's moving. Nice soft neck. The only issues I've had to help a little bit here is with head shyness, and we've done 3 or 4 little sessions with some of it, and mainly probably most of it was a psychological, that there'd been something going on before Galante came to this yard, which has made him head shy. Some of the breaking in practices aren't very kind to the horse, so whether it was anything to do with that, we have no idea what went on. So Galante's quite head shy. The first time I treated him, he really had his head up as high as he could do the whole time. A lot of fear there. This is interesting, isn't it? I've done a little bit of a slow-mo here. Doesn't he move beautifully? I think it's just wonderful, just an example of what a horse can move who's in training. This horse can go up to international level quite easily. He's just like beautifully put together, great conformation and a great mover. And so today I did a little bit of work around Galante's poll, and I looked a lot for tension, but really most of the tension is psychological. But for the first time today, he dropped his head right down as I was treating it. I probably spent 6 or 7 minutes working on both sides, just behind the head. And for the first time, he allowed the head to drop and released it way down, which for me is a fabulous sign, because it means that he's with me. The fear isn't there then when I was doing it. The fear had completely gone, and he allowed the relaxation to happen, and probably there was a release of tension as well. Otherwise he wouldn't have done that. So now you can see his neck is nice and soft. And a great thing I noticed with Carrie is that she's got such soft hands, and the way she trains them is just that they're completely with her. They're completely wanting to do what she wants, and they're loving the learning. And it's just really nice to see when you go to a top class dressage trainer how they do it with no roll cur or no forcefully using aids to get in the shape. They're just teaching the horse, and the horse is with them, wanting to learn and wanting to do the things to make the shapes that the trainer needs. So this is an example of a really good horse. I haven't found any pains except in the back of the poll, which is I think is completely gone now. So a great horse, and isn't he a beauty? So I think I'd just like to do a bit of a recap now, and how I approach my sessions with the horses. Of course, there needs to be a gentleness with them. It needs to be that the horse completely relaxes with you and understands what it's doing. And it was quite interesting today that the 3 horses I was with here, all after a minute or 2 started blowing up my nose from the nostril. So that's a really nice sign, and something which means that they want to know more about you, because of course they get a lot of feedback from blowing up your nostril and you doing the same back. But that's a really good sign if you get that with a horse, that it's not scared, even though you might have been going to a painful place, but that they understand what you're doing. So there's another wonderful slow-mo section here. Such a good mover, and this is what we want to see in the horses that we treat. We want to see balance and fluidity and no tension anywhere. So there's no tension in the neck or in the back, and everything is nice and balanced and even, which is really what we want to see. What a beautiful horse this is, yeah. Okay, getting back to the treatment and how I approach a horse. So I'm going to its front shoulder, I'm going to its head, I'm making friends with it, I'm not rushing, going to the painful place. I'm making contact first with the horse. And then it's a matter of investigation. If you've got a horse in a stable, you can treat it in a stable. I like to have a groom holding the horse. Of course, we all sometimes have to treat horses when they're tied up, but for me, I like the groom to be holding, not necessarily feeding the horse, unless it's the only way to calm it down if it's a bit of a frightened horse. But to me, the groom holding the horse, and inside or outside. Ideally, you'd want to see the horse walking first, but sometimes in life you can't have that. So, the first few steps of watching a horse move in, you can gain a lot by that. But sometimes you just got to go into a stable and treat a horse. So use your hands to judge. Unless it's a big spasm, you're not going to be able to see just from looking where the pain is. So you've got to get your hands on, and you've got to be kneading the surface. You've got to be massaging the surface, and lots of contact with the horse. You really do need to have lots of contact with it. Don't just go in there onto a painful part and do your release and think that that's going to be nice for the horse, because it's not. The horse needs lots of multiple contacts. You need to stay within its like energy field all the time. So there's no going in and out and stopping and talking to people. Just in your mind, talk to the horse and stay tight to it. Say one way that I helped Galante relax with his neck today is that I had my head on its neck while I was treating it, and I was talking to it at the same time in a very soft voice that only Galante could hear what I was saying. It was the tone of the voice, the softness of it, and that actual physical connection of my forehead on its neck, which gave Galante the kind of confidence to stay with me, to relax with me, and to drop its head and to allow all that tension to go. So I knew that it was a lot of psychological issues with it. Was association people go into its head to do whatever it did when it was very young. So now it's like a positive reinforcement, and it was like these days have gone. You're now in a beautiful place. You're in with some wonderful trainers and riders and owners, and that you can relax and let go of that fear. So that was when I was with the horse, that was my intention, that it would let go of the fear. Okay, whether it has or not, we'll see next time I come. Okay, so back into talking about how I do with treatments. You'll find bonding with a horse for the first minute or two is really important. And to me, with a horse that is really frightened, and a horse which somebody might say to you, this is a really dangerous horse, it just attacks everybody, it bites them or what have you. For me, with that, I'll go in towards his shoulder, and I'll be spending a lot of time with my head against his neck. Okay, I need that physical connection, and it seems to be that works really good with a horse. Okay, so I won't be doing any treatments or anything until I know that horse understands that I'm with it on its side, that I'm not a vet, I'm not going to stick anything in a needle into it or anything. And so I need that, maybe even if it's like 3 or 5 minutes of just my head is on its neck, and I'm gently massaging. Either it's usually the pec muscles on the front to release the endorphins. So obviously you have to take care of yourself and be very careful. I'm quite used to working with dangerous horses, and quite often it's a test that if I go to a different country, they want to see what I'm made of. So they'll like put me in with a horse that just is dangerous. And for you, it's probably best if you don't, because you've got to really look after yourself, because trying to heal one horse which then kicks you and puts you out of action for 6 weeks, it doesn't make any financial sense. It's better to lose that customer and lose that client than to injure yourself. So really, think about yourself and be very careful if you're with a horse that's a little bit frightened and full of fear, because that's probably a more specialist thing. It's wonderful to see Galante's front legs just stretching out. He's been taught dressage and enjoying the learning. You can see there's nothing forced about the teaching. It's just Galante enjoying what he's doing and trying to make the shapes that Carrie wants. Wonderful. So back to how I do a treatment. Get that bond in to start with, but then get your hands on, kneading and massaging and seeing the reactions that you get. So if you're working, you'll often see if you're working around the hips and the back legs, you're going to often see the tail flick up. So if a tail does a fast flick, that's a painful spot. So make notice of a fast flick of a tail is a painful spot. If it's a slow lifting of a tail, then you're on an area of tension for sure, and that's the area you should be. But it's not a pain that's frightening the horse. It's just yeah, you're there. I've actually got some human at last that knows where I'm in pain, and it's just like a little bit of a lifting of a tail. And quite often then, when you've done your trigger point releases and you've spent 2 or 3 minutes working on that area, that the tail will drop back down, and that will mean that the pain is released.